Proper shoe gear and support are crucial treatments for many of the problems that we see in the office. As such, we provide many different types of mechanical devices to help obtain this support. Of these devices, we supply our patients. The most important ones are the custom orthotic, brace, and diabetic shoe. As the back office assistant, your duties will entail preparing the patient to be casted for these different devices. The following tutorial will walk you through setup and shipping of custom orthotics, custom braces, and diabetic shoe gear.
Our office uses many different types of methods for gaining support to the foot. The most common type is the orthotic. It is a rigid support that helps to recreate the arch of the foot so that the muscles and ligaments do not have to work so hard to maintain it. This allows for relief of painful symptoms and for a slowdown in structural deformity. Two main types of orthotics are dispensed to our patients. The first is a prefabricated or prefab. It is white and is a piece of semi-rigid plastic that is generic to most foot types and helps to add some support. This is usually the first type of arch support provided to the patient to see if this treatment will be of benefit. After these prefabricated orthotics have been shown to be helpful, it is time to make a custom set of orthotics for the patient, casted specifically from their foot for their foot. Within each room you will have stocked, you will have placed Ziploc baggies with 4 splinting plaster strips in them. This is the plaster that will be used to cast the foot for a custom orthotic. Each foot will require 2 strips. You will then place below the patient's foot a new clean chucks and 2 chucks side by side on the floor. Run the water in the sink so that you can begin to warm it up. The warmer the water, the faster the plaster will set, which will allow the doctor to find the position he wants for the patient's foot and quickly cast the foot. You will place the basin filled with hot water on the ground in the middle of the chucks, and 1 set of 2 plaster strips on each side of the basin. It is important that you make sure the basin and the chucks are pulled far enough forward so that the physician can position himself at the foot of the patient without rolling onto the water, and so when he uses the water and plaster, he does not have to reach under the chair to retrieve it. The best way to prepare for the physician is to lay out the chucks while you are seated at the patient's foot. This will allow you to gauge the placement much better. Now that your materials are set up, you will need to take care of the paperwork side of the orthotic order. Retrieve a prescription form from the forms cubby hanging in the wall in the hallway, and make sure you grab the proper form with the correct physician's name on it. You will also grab an orthotic payment sheet from the cubby. The patient must sign this form and choose an option from the 2 provided. We will bill their insurance, but we cannot guarantee their insurance will pay. To keep everyone on the same page, we provide 2 payment options for the patient in case their insurance does not cover the orthotic. The first way is to pay all of the charge up front, which is $450. By doing so, they will receive a 20% discount, making the payment only $360. The second option is to sign up for the Care Credit Plan. This is much like a credit card. We get the money right away. They make payments to a company interest-free for 6 months. Whichever the patient chooses, they must choose one before we can cast them for orthotics. As the back office assistant, it is your job to have them sign the paper. However, if any financial questions arise, make sure you send them to our front office manager to deal with it. Once the patient signs the form, you will then fill out the name, date, age, weight, gender, and shoe size of the orthotic prescription, and let the physician know they're ready to be casted. A custom brace is much like a custom orthotic, except it's usually only casted for 1 foot at a time. The most common reason for receiving a brace is a patient with foot and ankle instability. Unlike custom orthotics, braces are an item in which we know usually who will pay for them, so we make sure the insurance issues are straight before we cast them. You will not need an orthotic payment sheet for the brace, but you will still need a prescription. We use a different company, so the prescription form is an MSI form. You again will fill out the patient's name, doctor, age, weight, and any demographic information, and make sure you ask the patient to specify if they would like a black or tan brace. The supplies you will need for an MSI or Arizona brace are as follows. 1 set of impression foam or biofoam, but you will want to bring 3 boxes. This is so we can ensure 90 degrees is the angle that we get. 1 roll of fiberglass casting tape, a stockinette, cast saw, large cast scissors, chucks, a basin of water, and rubber or plastic hollow tubing. You will then lower the chair so the patient can sit 90 degrees to the floor, or if the chair doesn't drop that far, have the patient sit on the seat or bench in the corner. The reason for extra biofoam boxes is to place their foot higher or lower depending on reaching 90 degrees. You will place the chucks on the floor under their foot and place all the supplies along with the basin of water near them for the physician to use. With all the supplies in place, you will then place the stockinette over the patient's foot and up the leg under the knee, and then slide the plastic rubber tubing up the front of the foot and skin. This will serve as a place to cut the fiberglass that will be wrapped around the ankle without cutting the patient. The patient is now ready for the doctor to come in and cast them for a brace. Diabetic shoes are designed to offer protection and support for our patients who have diabetes and neuropathy. Neuropathy occurs when the nerves begin to die, mainly within the lower extremities, causing numbness and sensation loss. This is common in diabetes and can be very dangerous for the patient. Without nerve or sensation, it is difficult to feel friction and wear, and healing is decreased. The diabetic shoe allows the patient to receive the proper support while decreasing their chances of frictional wear on the foot. In order for patients to qualify for custom diabetic shoe gear, they must have diabetes and neuropathy. To prepare the patients for diabetic shoe gear, you will need to fill out the proper paperwork and measure the patient's feet. The first piece of paperwork is the doctor's certification letter. This is the letter sent to insurance stating the reasons why the patient needs these diabetic shoe gear. Fill out both pages. The patient must be diabetic and on some type of diabetic medication, and they must have neuropathy. These two options must be in place in order for these shoes to be covered. But there are also other options that may be secondary reasons for receiving the shoes, such as foot deformity and so on. Next, you will need to fill out the shoe and insert prescription forms. This is done during their visit and while you're measuring their foot. Make sure you fill in all the blanks like name and date, and whether they've had the shoes before or not. Under the order type section, you will choose custom inserts with shoes. When you get to the custom insert type, you will choose the total contact bilaminate insert. This is the first option under that section. And choose the option that allows the patient to receive 3 pairs of inserts. You will now need to gather the supplies for casting the patient's foot. The supplies you will need will be a biofoam box, which will take the impression of the foot, and your custom shoe supply box. Within this box is contained the brochure for the patients to see and pick the type of shoe they desire, the ink to roll on the Harris mat, the Harris mat itself, the Brannock measuring device, and 2 pieces of extra long paper. To begin, have the patient remove their shoes and socks and stand at the doorway. The doorway will provide some support as they are being measured. Next, you will place the biofoam box on the floor and have the patient step into the foam, each side for each foot. The idea is to get an impression of the way their foot is positioned while standing. It is important they strike the foam directly in the center and from above, so they will need to have their knee forward over the foot to ensure proper placement and even pressure dispersal. Next, apply some ink to the Harris mat and roll the ink evenly along the mat. Place the extra long piece of paper under the inked portion of the mat and place it on the ground. You will now have the patient stand directly on the mat, making sure to have them again bring their knee forward to even out the pressure. Have them stand with the normal weight on the foot. 2 things are happening while they do this. First, you're showing the dimensions of their foot when standing. Second, depending on the pressure they place on the pad, it will show up darker or lighter. These darker spots show where more pressure is being placed and allow the shoe company to customize the shoe to offset this pressure. Using a capped pen, you will then trace around the patient's foot. This will draw an outline in the patient's foot in the ink so the dimensions of the foot are exact. Now, using the Brannock device, you will measure the foot. This device is set up specifically for men or women, so grab the proper device. On each side, it shows either left or right heel. Make sure you use the correct side for the correct foot. Have the patient place their heel in the heel cup as snug as they can. They will then need to stand on the device so as to place all their weight on the foot. When standing, the foot will naturally flatten. so it's important we measure the weight-bearing feet so the shoes are not too tight. There are two sides to this device. The first is the hallux wedge, which should be lined up with the hallux or first metatarsophalangeal joint. The second is the slider on the opposite side that will close in on the side of the foot. This measures the width of the foot. Look to the toes and find the line that is nearest to where the toes reach. If they are between a line, always round up to the next line so that the shoe is not too small. When you have a number, look to the side slider and find the number. It will correspond to a letter. This letter is the width of the foot. All of these measurements need to be placed on the order sheet. As you measure the foot, you will also need to specify observable trends to the patient's foot, such as arch height, bunion size, hammer toe intensity, and swelling. You will follow all the measuring instructions as shown on the order form. Make sure to use the measuring tape to measure the tops of the feet from side to side for the height of the shoe. You are now ready to send in the order. After the physician has made impressions necessary for braces, shoes, and orthotics, you will need to prepare them to be sent off and made. The prescription forms must be filled out by the doctor before this can happen, and a copy must be scanned into the patient's chart, or the carbon copy must be given to the ladies up front in the box. You will need to rubber band the prescription form around the impressions made and package them to be shipped out. They will be placed in a box and sealed up with the shipping label attached to them. If they require a pickup by FedEx or UPS, they will then need to be called for the pickup. Orthotics, braces, and shoes need to be sent out as quick as possible, but we need to be smart about it as well. It is not cost effective to send one pair at a time, so it's customary to wait until a full box can be filled, but no more than an extra day from the day they were casted. If you are working in Centralia, you will need to prepare each day for your castings that will be used and sent by United States Postal Service to be brought up to the Tumwater office. The mail is not picked up in the Centralia office. Any items to be shipped must be prepared, pickup scheduled if necessary, and then taken to the front office to be picked up. Make sure you ask if you're not sure where to place an item to be picked up, and let the ladies up front know when someone comes to get it. When orthotics come into the office, the front office will receive them and check them in. They will then give them to the back office to place in the orthotic cubbies and be prepared for the patient. The patient will be called by the front office and they will be dispensed to the patient. 80% of the orthotic dispensing will be performed by the front office staff. They will have checked in the orthotics and called the patient, letting them know their orthotics are ready. Dispensing does not require a formal appointment. So when a patient comes in to receive their orthotics, it is crucial the front office staff be able to find them easily. As such, it is important that as the back office, we place the orthotics as neatly and orderly in the cubbies as possible. Alphabetic order means alphabetic order. We need to take the extra time to organize the orthotics as we put them away. At times, it will work out so that the patient will follow up when their orthotics are in, so it will be the back office assistant's duty to dispense the orthotics. To dispense the orthotics, you will grab the correct patient's orthotics and an orthotic instruction sheet. After you have removed the patient's shoes, you will place the orthotics up to their bare foot and check for size and fit. The orthotics should fit pretty close around the foot, and the edges, towards the toes, should stop right before the hallux or big toe joint. If it is a full-length top cover, you will need to cut it to fit within the shoe. You will then make sure they know which side is left and which side is right. It is written on the other side of the orthotic. Place the orthotic in their shoe and explain the break-in instructions to them. Because the orthotic is different from what they have ever walked with, it will adjust their foot to be in a position that is optimal for their foot. By doing so, it will change the angle of the joints slightly in the foot, as well as the ankle, knees, and hips. Although slight, if they were to walk on their orthotics all day that day, they would be sore in a week. It therefore is important that they take 8 days to break in their orthotics. For the first day, they will wear their orthotic only 1 hour, and remove the orthotic from their shoe. The second day, they will wear the orthotic 2 hours. Then the third day, 3 hours. Fourth, 4 hours, and so on until they are up to 8 hours or 8 days. This will ensure their body has ample time to get used to the new adjustment in their joint angles. If the orthotic comes with a top cover, you will need to instruct them to remove their current insert in the shoes and cut the orthotic top cover to fit in the shoe. If they have no top cover, they may keep their insert in the shoe. For dispensing braces, the patient will need an appointment. The doctor will need to examine the brace on the patient and make sure everything is well, so have them come in and bring the brace to the room. Have the patient place the brace on and walk around a bit with the brace to feel for any pressure places or discomfort while they wait to see the physician. When a patient comes into the office to pick up their diabetic shoes, they will need to be placed in a room and have their shoes and socks removed. You will then retrieve the shoes and inserts, which are in separate packaging because different companies make them. You will also retrieve paperwork for returning the shoes as well as acknowledgement of receipt. You will place the shoes on the patient and have them walk around the office to check for initial comfort and feel. You must make sure they understand they have 30 days to return the shoes. However, in order to return the shoes, they must have worn the shoes inside only. If there is any wear or tear from wearing outside, the shoes cannot be returned, and they must sign the return policy stating they understand this information. Medicare requires that we document the number of shoes and inserts we provide to the patient. So on the Medicare documentation form, fill in 1 pair for shoes and 3 inserts, and have the patient sign the form. Remove their shoes and place them in the box to be sent home with the patient. Remember, they must not wear them outside until they are certain the fit is good.